Hi everyone, my name is jiamei Wang. Today's presentation is about Mr. David Nazo's exacerbation of COPD. I will discuss Mr. Nazo's A to G assessment, 4 nursing interventions to manage his exacerbation, and 4 nursing consideration when delivering the care. Firstly, we're going to start the airway. David's airway is patent and maintaining his own airway. Patients with COPD often present with respiratory tract infection, such as spectrum purulence, that David is present. Therefore, it's important to monitor his airway status, such as increased secretion or obstruction. We're going to look at breathing now. David's respiratory rate is 30 beats per minute, indicate tachypnea due to increased work of breathing. Diminished breathing sound bilaterally with wheezing and crackles in the lung base indicates infection in the lung. Wheezing and crackles are due to airflow obstruction that caused by respiratory tract pathological changes. Using accessory muscles of the respiratory indicates an increased respiratory effort and fatigue. Oxygen saturation is 78 in room air due to chronic hypoxemia, as the oxygen saturation is lower than 88 to 92%. Mr. Nazo present with an increased shortness of breath. Purulent yellow spectrum is suggested a bronchopulmonary infection. C. Circulation. Heart rate is 128 beats per minute. Sinus tachycardia happens when body is trying to compensate with hypoxemia. David's capillary refill time is 3 seconds, indicates a poor perfusion. Circulation impairment can lead to shock that damages the organ. Blood pressure is 168/85. Hypertension. Unstable blood pressure elevates due to the hypoxemia. There's evidence that indicates half of the patient with acute exacerbation of COPD having cardiovascular disease. Due to the hypoxemia and distress, it can lead to tachycardia and hypertension. Therefore, it is important to manage blood pressure and heart rate. Disability GCS 14 E4V4 Arm 6. Confused and distressed. The increase of carbon dioxide in older adults can cause neurological depression. Hypoxemia and hypercapnia can lead to confusion. It is therefore crucial to improve oxygen levels and improve his mental state. E. Exposure febrile. David is having COVID-19 infection. There's evidence demonstrate that the COPD patient has worsened outcome upon COVID-19 infection due to the angiotensin converting enzyme 2 expression is elevated on the bronchoalveolar cells. Fever is an indication of inflammatory response to infection. The infection will trigger systematic inflammation, and if there's not managed well, can contribute to tissue injury or organ dysfunction. Next, we are going to move on 4 different nursing interventions that help Mr. David Nazo with his exacerbation of COPD. Firstly, we're going to look at oxygen therapy. Supplemental oxygen therapy is one of the essential treatments for patients with COPD. While David is facing high risk of hypoxemia, that his oxygen saturation is 78 in room air, it is important to target oxygen saturation to between 88 to 92 in order to achieve evidence-based safety oxygen therapy for patients with exacerbation of COPD. At the same time, carbon dioxide level rise too high will lead to hypercapnia and maintenance ventilation decreased. It is therefore important to monitor carbon dioxide level. It is also recommended that regular monitor how patient is responding to the therapy to provide person-centered care. Admit bronchodilator. Inhaled bronchodilator are considered as effective treatment of acute exacerbation of COPD due to the agents target the bronchial hyperactivity and improve airflow obstruction. Both nebulizer and the metered dose inhaler are effective at relieve acute airflow obstruction and improve oxygen exchange. Therefore, bronchodilator is beneficial for David when he is experiencing dysphonia and improving ventilation. Administer corticosteroids. Corticosteroids is considered as effective as suppressed airway inflammation and improve lung function that helps patients to breathe. Therefore, corticosteroids will improve David's airflow and reducing exacerbation of COPD. There is evidence suggests that anti-inflammatory therapy is beneficial for patients with airway impairment. Therefore, corticosteroids are important for David's infection. However, it is important to educate patients that longer course will have no further benefit and it increases higher adverse effect. Administer antibiotics. Antibiotics are considered crucial for patients with acute exacerbation of COPD as bacteria in the airway. There is evidence suggested that 50% of acute exacerbation COPD patients are detected bacteria in the spectrum. Due to David has increased dyspnea and spectrum symptom, antibiotics is recommended. Finally, we're going to look at nursing consideration when administer therapy and medication to David. Firstly, oxygen therapy. For patients with COPD, they can get oxygen saturation to up to 88 to 92%. Pulse oximetry can be used to measure saturation of hemoglobin. For COPD patients with hypoxemia, targeting oxygen saturation of 88 to 92 to avoid hypoxemia. There is an article suggested the importance of avoid excessive oxygen administration because of worsened hypocapnia due to carbon dioxide retention. Therefore, monitor oxygen saturation is important because despite achieving target oxygen saturation level, but we do not want it getting too high due to the risk of hypoxemia. Oxygen can be titrated and delivered by nasal cannula at 85 to 92 oxygen saturation nasal cannula. A face mask can be ordered for David due to his oxygen saturation is less than 85%. There's a high risk of carbon dioxide retention with hypoxia and adverse effects with delivery methods such as dry nasal passage with nasal pumps. Salbutamol is an inhaled beta agonist. It relaxes the airway muscles, therefore it induces David's bronchospasms. It is important to check heart rate due to salbutamol can activate sympathetic nervous system. Salbutamol is a breath activated inhaler that medication will get released automatically during inhalation. It is important to note that care should be delivered with hypertension patient due to the potential unwanted stimulation to cardiac adrenaline receptor. Therefore, it is important to monitor Mr. Dazo's blood pressure. The side effects are headache, tachycardia, coughing, tremors. Apotropine is an anti-muscarinic agent bronchodilator as a short-acting muscarinic antagonist is a rescue medication that used as relief of breathlessness. It inhibits the muscarinic acetylcholine receptor of the pulmonary smooth muscles and achieve bronchodilator effect. Apotropine can be administered via nebulizer device. Common side effects are dry mouth, headache, dizziness, tachycardia, and palpitation. Prednisolone is a corticosteroid therapy generally used for treating emphysema. It is important to note that except 1 mg tablets, others should not be broken. The common adverse effects are constipation, hypertension, headache, and nausea. Therefore, it's important to check David's blood pressure before giving. Azithromycin is an antibiotic used by treating pneumonia. It can treat David's purulent spectrum. Azithromycin should be administered by IV infusion. According to Mims Online 2024, side effects are diarrhea, IV side pain, nausea, abnormal pain, vomiting. Paxlovid is used by treating coronavirus disease 2019. Nirmatrelvir must be taken with ritonavir orally to achieve desired therapeutic effect. According to Mims Online 2024, headache, diarrhea, nausea, common side effects. That's all the information I'm having today. Thank you for listening. Bye.